The Global Alliance for Vaccines and Immunization, acronym GAVI, is a public-private global health partnership meant to increase access to immunization in poor countries, and the Gambia is a beneficiary. Personnel of the Ministry of Health and stakeholders, including WHO and UNICEF, are now discussing progress made in the initiative in a special review forum. The joint appraisal meeting is an essential element of GAVI's regular monitoring and performance management, aligned with its strategic goals. Dr. Fatoumata Diba is the Deputy Director of Health Services at the Ministry of Health.
The GAVI team is one of our key partners, and they support us a lot as a sector, the Ministry of Health, WHO and UNICEF. We appreciate all you're doing for the Gambian children. So we are gathered this morning to do a joint appraisal. And that is to say that we are gathered to see the funds that we are receiving from our partners and the interventions that we are doing. Where are we doing well? What are our shortcomings, and what can we improve on? So I think this is good, and we welcome everyone to another joint appraisal. And we encourage everyone to ensure that we have very fruitful and constructive discussions.
The Gambia is one of the developing countries struggling to score the desired 95% score in national immunization coverage. This, coupled with financial challenges, are obstacles the Ministry of Health and partners are determined to overcome as they meet for the regular monitoring and performance management. Dr. Nathan, the WHO country representative, said his office will continue strengthening healthcare partnership to expand immunization.
And I had an opportunity to go and visit this child who had developed polio. It was a 3-year-old girl in very good nutritional state, but somebody had not cared enough to take her for her doses, and she had got polio. So we went to this home and we found the child seated on the ground. And when you looked at this child, everything looked normal. Like I said, she was in very good nutritional state until they asked her to stand, and we realized that both her legs were gone. Today, we are here to review our immunization program.
The GAVI Joint Appraisal Meeting is a 4-day convergence in which stakeholders are expected to discuss challenges and progress made, whilst charting a way forward to boost the Gambia's immunization programs. Every child matters, said Nafisa Binte, the UNICEF country representative, who underscored the importance of vaccines.
What we need to also do is change our strategy to transform the entire immunization game plan. And that transformation will come from this group. When we talk about transformation, it's more like how do we sustain the regular immunization? How do we make sure every child is reached? How do we make sure there is no gender discrimination in this entire immunization game? How do we make sure the fathers are playing their roles to take their children for immunization, and it is not overburdening the mothers who already is overburdened by so many other chores and also agro-based work.
Established in 2000 to address challenges of stalled international immunization programs and lack of affordable vaccines for children in developing countries, GAVI's objective align with the Gambia's set goals in health. Its programs in the Gambia are focused on increasing access to vaccines for children, strengthening healthcare systems, and improving data collection and management related to national immunization. Janket Toure, GRTS.